Across Belize, from Punta Gorda in the south to Corozal in the north, Quiet Revolution is powering up our every regional hospital. Solar energy is transforming how our healthcare facilities operate, making them more sustainable, resilient, and cost-effective.
I've been in Punta Gorda for the past 4 years, and my experience for these 4 years that Punta Gorda has very unstable electricity. Means we have frequent power outages. With the panels now, we have a constant supply of energy. We don't have any setback when the power goes away.
This initiative strengthens our health system by developing disaster-resilient, environmentally friendly health facilities.
So our biggest problem is hurricanes or any storm. Now, if there's a storm or there's any power outages, normally we need to move out of the hospital and go to another building. Problem is that the other buildings won't have the features that we have. I'll give you an example. If we had a delivery and there's no electricity, we would usually put flashlights on. Now with the solar panels, we could have our urgent procedures, we could have our patient care still ongoing while electricity is out, and we could function as soon as the storm is past. With the panels and the solar system, now our patients can receive a reliable health care.
The amount of power being produced by these systems on a sunny day can power approximately 200 Belizean homes. And with the Shiner app, monitoring performance of solar panels is simple and accessible and can be viewed in real time directly from a smartphone, empowering facility managers to respond quickly and optimize performance from anywhere.
Some of the key features of the solar systems that we've installed for the health facilities throughout the country includes the installation of over 1,000 solar panels that will be able to generate somewhere between 1,800 to 2,000 kilowatt hours of electricity per day. And based on our estimates, that will result in a carbon footprint reduction of over 300 tons of carbon annually.
When you look more in depth into the cost of the hospital, even though we don't pay a bill, the government pays a bill. So that reduction in cost to the government will trickle down to the staff and to the patients.
Furthermore, advanced battery storage ensures uninterrupted power during outages.
The battery backup systems ensure a seamless transition whenever there is a power grid failure, for instance, planned failure or in an emergency, that will power critical systems within the facility, like their refrigeration for reagents will be kept powered because of the battery backup system.
Rows of solar panels now catch the first light of dawn. Their resilient harvest turns sunlight into lifeblood, alleviating Belize's health system dependency on fossil fuel.
So the solar panels are also very important for the health sector, for them to be able to reduce their carbon footprint. We want to try and reduce the emission of greenhouse gases, and the health sector is a large contributor to that. With the solar panels, we will be moving that reliance from fossil fuels and also ensuring sustainability of electrical power during events such as hurricanes.
Shrinking its carbon shadow and feeding clean power back into the grid under the new feed-in tariff. Belize is writing a new prescription that heals patients today while preserving the planet for tomorrow.
And so it is important, especially for the critical areas operating theater, labor and delivery, accident and emergency departments, to have access to power during this time. And so the solar panels will be very useful for the Ministry of Health.
So with solar panel and solar source, it also reduces our operational costs over time. And so it allows us with these savings then to be reinvested into our health system. What is most important is that it ensures that no matter where you live in Belize, your health facility has the power it needs to deliver care when needed.
This was made possible through the European Union-funded Health Sector Support Program Belize Project, implemented by the Pan-American Health Organization, World Health Organization, in collaboration with the Ministry of Health and Wellness. The European Union-funded Health Sector Support Program Belize Project, achieving a better quality of life for all Belizeans living now and in the future.